Are diazepam and lorazepam the same? Diazepam and lorazepam are both medications within the benzodiazepine family, which means they share some characteristics in terms of their chemical structure and their effects on the brain. However, they are not the same medication and have different properties, dosages, and uses. Diazepam, Valium. Diazepam has been used for a longer period than lorazepam in clinical practice. It is often prescribed to treat anxiety, muscle spasms, seizures, and sometimes to alleviate symptoms of alcohol withdrawal. It has a relatively long half-life, meaning it stays in the body for an extended period, usually 20,100 hours. This can lead to a buildup of the drug in the system, especially with repeated dosing, which may be a consideration in long-term treatment. Lorazepam, Ativan. Lorazepam, on the other hand, is commonly used for the short-term treatment of anxiety disorders, insomnia due to anxiety or transient situational stress, and is also administered before anesthesia for sedation. It has a shorter half-life than diazepam, typically around 10-20 hours, which can reduce the risk of accumulation and potentially lessen the severity of withdrawal symptoms upon cessation. Both diazepam and lorazepam work by enhancing the effect of the neurotransmitter GABA, gamma-aminobutyric acid, in the brain, which has a calming effect on the nervous system. They are both effective as sedatives, anti-anxiety medications, and muscle relaxants, though their usage may differ based on the individual needs of the patient, the specific condition being treated, and the desired duration of effect. Due to their potential for dependence and withdrawal, these medications are typically prescribed for short-term use and should be taken under the guidance of a healthcare professional. Despite their similarities, the choice between diazepam and lorazepam ultimately depends on the clinical situation, the patient's medical history, and the prescribing doctor's discretion. An example of how these medications might be differently prescribed could be in the case of a patient who requires a muscle relaxant for a chronic condition. Diazepam might be chosen due to its longer duration of action and effectiveness in muscle relaxation. Conversely, for a patient who is experiencing acute anxiety with difficulty sleeping, lorazepam might be favored because of its shorter half-life, making it less likely to affect the patient the following day.